One of my other favorite patients, we put her on a ketogenic diet and we got her all of her meds. She wanted a knee replacement because she was miserable pain. It was my medical assistant's mom of all people, but she was crying. She came in. I go, I can't clear you. Like, I've been talking about cutting your, and she's Hispanic origin. So she's like tortillas and flan and like horrible diet. And I go, and sodas all day. I'm like, you got to either go on insulin or we do lifestyle. If you go on insulin, you're going to gain 30. Here's where your future on insulin. Here's what we do with lifestyle. And I go, if you give me 6 weeks, just be serious for 6 weeks, and I'll clear you for surgery if you get your A1. Her A1C was like 11. And I go, if we can get you below 8, I'll clear you for surgery because I know it's going to be lower because it's a 3-month sugar average and there's only half of it. So I said, look, here's what you do. And so 6 weeks later, here she comes, and I see her husband, and she wasn't in there yet. And I said, how's she doing? He kind of shook his head like, I'm not saying anything. I'm like, oh, gosh, okay, we'll get her meds and we'll get her figured out. Anyways, she comes in, she goes, did you see my weight? She lost like 16 pounds. Blood pressure normalized. And we checked her A1C. It's only been 6 weeks. It dropped in half. And you're like, she was under 7. She was at 6.5. I was like, you got to be kidding me. And I go, okay, you know what? You did your work. You're cleared for surgery. I'll clear you. And we had to take her off 3 meds that day. And she said, hold on. I said, what? She said, my knee doesn't hurt anymore. Yeah. Like, you're kidding me, right? So I leave. I go, come on. And she goes, no, seriously. She goes, I'm at like where I am now. There's a high school right behind us. And she goes, I'm going up and down the bleachers like 8 times a day, up and down. I'm like, you're kidding me? Because she couldn't walk. I mean, she was miserable pain. And so she didn't get surgery. And so I was so excited. I called Ben Bickman. I go, you're not going to believe this, Ben. Listen to this. And he goes, did you not see my study? Like, they had already studied this. So you decrease the inflammation, the joint pain, back pain, all these other things get better. And that's why it's so, people don't put 2 and 2 together on those things.